Okay, I'd like to welcome everybody back to the Commission to Study the Costs of Special Education. We're going into our, fifth meeting or so here to look at this whole responsibility we have. Does everybody have a copy of the agenda in front of you there?
Yeah.
Okay, so we do have an agenda here, and we also have a set of minutes here. And Madam Clerk, are these the way that you like to see them go into the record, or do you want to do something about it?
I do have two small edits, Mr.
Okay,
Chair.
so let's then take that first thing on, approve the minutes of November 21, 23025. There's an error right there in the agenda.
Yes.
So at any rate, let's take that up right now. Is there a motion to approve? And if there is such a motion, then during the discussion, you can add to it.
Sure.
Is there a motion to approve the agenda?
Sure.
Representative Ames is second by
I'll second that.
Representative Freeman. So with that, further discussion. Madam
Yeah.
Clerk.
Yes, thank you, Mr. Chair. For the record, I just noticed that I omitted the date at the top, so I would like to have that reflect the record of November 21st, 2025. And then on the third, well, it would technically be 1, 2, 3, 4, 5. Fifth page, my apologies to Dwayne Ford. I left out an A when I was typing your name, so I'd like to correct your name spelling. But those are my apologies. I will make that Scrivener's error changed.
The sentence here, first page.
Sentence on the first page.
Which one you're talking about here?
Confirm if he is with the state, with the scholarship fund.
Oh, thank you. I will remove, would it make sense to say, to confirm with the state, I believe is what that says, the nonprofit status with the state. Jen Doloff asked about the nonprofit status and
We
contract.
were just asking if he was with, who he was with.
Yeah, yes, sorry, to confirm who he was with, thank you.
So it should be with the
Scholarship fund.
Yeah, with the scholarship fund. And, we might put in that, what his title over there is. Is he a what? Business manager, PR person? Is
No,
he-
I think he was finance, if I remember, it was finance.
Let's try to get it clarified what his exact title is for the scholarship fund. That's not, this is just phone call and we can get that. in.
Sure.
Are there any other suggestions for modifying this?
Yeah, Mr. Chairman, if we could, where it references my name in the beginning, members present, it says advocate for special education, DOE.
Oh.
And just scratch DOE.
Scratch DOE, my apologies, thank you.
Okay.
I have that corrected for this minute, thank you.
I want to say one thing though. I appreciate having a clerk that is so, she's a tiger at getting everything in here, and you don't have to do that. You can summarize a little bit. So,
Okay.
But we understand there's going to be T's needing to be crossed and I's needing to be dotted, but those are technical things which we can absorb quite easily here. So,
Great.
Are there any other suggestions other than the amendments that have been mentioned here at the table by the clerk and by?
Oh, Representative Ames
Yes.
has something as well.
Up above, we were looking for the title of Sutherton, and it's right here on the first page.
Oh, it says, yes, it does say
Okay.
Matt
Director of
Sutherton's.
Policy and Compliance.
Okay, thank you,
Thank you.
Representative Ames.
First sentence, page 3.
For page 3,
Page 3 is you asked about requalification, differentiated aid, or are they? What?
Oh, I think it's just, I'll strike the or are they, thank you.
Okay, fourth line down. They have to exhaust private insurance first before receiving differentiated aid.
Thank you.
is everybody else good with it, or just want to wait and do this at the end of the meeting? Okay, let's go ahead with the
Amended changes.
those amendments or changes which have been mentioned at the table here earlier this morning. Is there any further discussion? So we will be approving the minutes as amended at the table.
Okay.
Any further? All those in favor?
Aye.
Aye. Any opposed?
Any
I
abstentions?
will abstain.
Any,
I was not present
and
at the
those
last
that
meeting.
weren't here, the two senators and Representative Freeman were not here, so they're abstaining.
Thank you.
Okay. Thank you very much. Let's look at the agenda right now. And we, in the last 4 meetings, have had a lot of information thrown at us, and there's a lot of questions which have come out through the discussion which need follow-up and some further research and further documentation and probably some spreadsheets as well. What I'd like to do today, I took a look prior to my heading down to Carolina this last weekend, is to look at what our responsibilities are here in the SB 57. And there are some responsibilities here that I think we really need to address, but I want to know what is the order, what is our prioritization in terms of looking at that. And when we look at it, and I reflect back in the time I was a school administrator, and we had a simple little phraseology, we call it the STP. We tried to identify the situation. We tried to identify where we wanted to be at the outcome or the target. And then the proposal, how are we going to get to that outcome? How are we going to get to that target? And I'd like to look at that in terms of all these here. There's some that are going to need more research and a lot of work. And I don't want to leave it to the last moment and then say, oh, we didn't hit that. So let's just open this up right now and look at these right through 1 through 13 under Roman 4 here. And the first one being student referral rates by IDEA category for special ed programs. And Melissa's here, right? Why? I want to introduce Melissa. We don't have Rebecca here today, but Melissa is Rebecca's administrator. Is that how it works? You're the boss or what?
We're looking at the hierarchy, yes, that will be considered her supervisor.
Melissa White, Division Director for Learner Support at the Department of Ed.
And so Melissa will be here to really stand in and answer any questions that Rebecca would have been doing here on the committee today. So just to introduce her. Going down through those 1 through 13, I'd like to see us try to either combine some of these or start looking at how we're going to address and attack that. And why are students labeled other health impaired? Mm-hmm. The increase of referrals since COVID school closures. Is there an increase in referrals since school closures with the COVID? Are there interventions that can be implemented prior to referrals for SPED for some IDEA categories? How are we addressing the intervention process? Are we doing it in the 3-tiered process we have, or is there something else that we're doing individually in schools? Or is there nothing going on? Going down to Roman 5, costs to provide services which are not medically necessary as defined by Medicaid, including services which are required to meet a child's agreed upon goals as part of their IEP, and services required as part of a 504 plan. So we need to address that one for sure. Excuse me. Roman 6 there, comparison of the processes, requirements, and services under federal law, state law, and New Hampshire DOE administrative rules. There's a lot of challenge there. We are going beyond, in some cases, in our state law than IDEA. And then we have to look at how our rules are written in terms of, are they reflecting what we have in IDEA, or are they reflecting what we have in our state statutes? Reporting of SPED costs to the Department of Education. What's going on in terms of reporting for the student that's not catastrophic aid or special education aid? 0 through the rough $70,000 mark. is there any reporting going on there? What does that oversight look like? Local districts' costs for out-of-district placement, and are there other options available? This can, the residential placement or the sharing of resources by districts. I know there's some activity in the state right now where there is a district that's looking at, can we combine them? I'd like to also know what Claremont did. They had students which were in residential placement. Are they still in residential placement, or are they returned, and are they going to be working in one of those vacant elementary schools? Bluff. We'll get to it. We'll get to it. Yeah. Going further down here, analysts and analysis and effectiveness of local district developed dispute resolution options. That has been an issue for years. The use of state funds to provide services, Medicaid to schools program, use of insurance by local districts to contract for legal services. Has private insurance been used in addition to the Medicaid? Do we ask that that be done? Graduation rates for students with disabilities by type of diploma and age, and attendance in adult learning programs. There's a lot here. So I'd like to just open it up for discussion right now so that, and also there was a draft sheet that you put together, Rebecca.
The other Becky.
Becky, that I have in front of me, which you tried to identify some areas which we might want to look at, the funding source for these things. So it's open to discussion right now. Representative Ames.
Thank you. This morning before we started, I looked at our calendar that just came out, and it's very thick, and we've all got a lot of reading and study to do on it. But under education funding, there's a bill, HB 742, which relates to requiring catastrophic special ed state aid funding. And I won't go into the details of it, but it was an occasion for the chair who wrote the report, it's a great report, to point out what you've pointed out before, but I just want to underscore it and make a suggestion.
Well, you might read the report. So, do you?
The whole of the report
Is it a lengthy one?
Sure, I can do it because it's all context.
Because there are people here that probably don't know.
So this bill, which is House Bill 742, is the recommendation is refer for interim study. So put it aside while we do other things and then look at it when we can. Is what interim study means. This bill removes the prorated distribution requirement when insufficient special education funding is appropriated by the state. For example, in the previous session, $34 million was appropriated for special education aid, parens, catastrophic aid, close parens. The actual cost for this period of time amounted to, and he's talking about special education, catastrophic aid now, the actual cost for this period of time amounted to $50+ million, a $16 million shortfall. Due to the shortfall, funds received by local education agencies were prorated to 68% of the actual amount spent. As introduced, this bill would require the governor to draw a warrant for the Education Trust Fund to satisfy the shortfall amount. If the balance in the Education Trust Fund after the issuance of the warrant is less than zero, the state comptroller would be required to transfer sufficient funds from the general fund to eliminate the shortfall. To address shortfall type issues in the future, a statute change was made this previous year to set the proration amount at 80%, a higher level than before or in the previous year. The Education Funding Committee has recommended interim study on this bill as the issue of costing special education is currently underway by a statutory commission addressing the costing and accountability for all aspects of special education by federal, state, and local governments. The commission recognizes that local education agencies cannot continue to support 85% of special education costs. In fiscal year 24, special education costs totaled $977.1 million, of which the state appropriated $33.9 million for special education aid. That's the catastrophic aid category. $67.4 million for differentiated special education aid, and the federal, let's see, am I skipping something? And the federal government contributed $50.8 million, and that's under the IDEA, the federal law. Local districts then covered the difference, $825.1 million. And then the study commission's report is due July 1, 2026, as a reminder to all of us. What I wanted to suggest is that at this this broad level, we should, at the end, when this is all done, make clear that the federal government needs to provide more support than it's currently providing. That would be sort of an advocacy point. And the context we all know, or most of us know, is that there was a promise when all this started out with the IDEA that the federal government would pay significant sums, and they've fallen way short. And that the state should also be paying more for special education than these numbers that were true for fiscal year 24. And that we're overburdening the local education districts by failing at the state and federal level to provide the support that that really is essential to ensuring that every child gets a free and appropriate public education that responds to the needs of that child in the least restrictive environment and so forth. So that's my suggestion, that we flag that as a marker that that simply can be stated at the beginning of a report or at the end of a report.
Yes, Senator Sullivan, excuse me.
It's fun. Do that. So I just, looking through this, I think there's a big piece that we're missing here, and maybe it's another study committee, but we're not looking at the school environments that might be causing some of these issues, right? So when we're looking at Roman numeral, was it 2? Why students labeled other health impaired? Is that because of things that are happening in the school causing anxiety, depression, the bullying? Maybe for some kids it's sitting too long and they're acting out because they need to be moving around. They've got all that energy. And we're not looking at why. I mean, Manchester is now up to 26% of the student body is special needs, categorized as special needs. So you have to look at like what is happening in these schools where this is continuing to increase. And sort that out. And we all know about the bullying situations that are not addressed and how that impacts kids. So I think that's a big piece of this puzzle that we need to talk about. Again, it might be a totally different study committee, but when we're looking at a rise across the state and special kids that are identified as special education, I think we need to start asking why that's happening. Thank you. That's all.
And I just to tag you just a bit, and then during the time that we looked at the bill that Representative Ames just read the committee report on, and this topic has been brought to the Education Committee prior to our even having an Education Funding Committee. When I was in chair of the Education Policy Committee, Mary Guile and I looked at the same issue years ago. I can't even count back that far. That there was an issue then, are we not prorating this at the right amount? Should we be prorating it, not at the 67, 68%? Should we, maybe at this 80%, which is now law? Or should we be doing what that bill said, not prorating at all and paying our obligation? But then the question came up, and that goes to where Senator Sullivan is right now. There are these questions which have to be answered. In terms of the mental health in our society today. And that's coming into the schools. And how is that really directly and indirectly impacting our students? and the costs associated with this. We're seeing that our enrollment with students that have IEPs, is at the same level, same number of kids that we had back in 2010. And yet the population statewide has decreased over 50,000 kids. So what's going on here? And then the question that I've heard from some, and it's not necessarily coming from Rick Ladd, but I also do ask the question whether I actually believe, are we over-identifying students? And how do we identify as a commission here how do we analyze that situation? And we have to dig down into the school districts. There's a lot of unanswered questions. Do we have properly trained people in the schools? Do all schools have this opportunity to provide speech therapy? And you can't provide it on the web to a student. And that costs more and more and more. So you have these contracted services, the transportation costs. So all these things have to be looked at. And I concur with you, Senator, that there are other issues that are driving these costs. And residential placement is certainly going to be, something we need to look at. Can we keep some of these kids in our own state and do that? So I'll just open it up to Dr. Dull.
I just caution I caution the use of numbers. The numbers on the DOE website are inflated. I don't believe that 26% of Manchester is identified, though I believe that's probably what's reported. I think we talked about that previously. And I'm just cautioning. So I do think that there is an increase. I don't dispute that. I just, I mentioned at the last meeting that the district I work in has considerably less than what's identified. And I spoke to the folks at the DOE, and they reported that the way that they register these kids as identified is a bit confusing. So I think it's not clear whether, if there are 26% identified, for example, in a district, does that include children in charter schools? Does that include children who are receiving EFA funds? Or is that every child in Manchester that ever had an identification throughout the school year? So there's some confusion about that. And I just raise that as a cautionary thing, not to dispute any.
So, yes.
May I ask a question? If that is the case, then can we have somebody from the DOE
Well,
clarify that?
I was just going to have, Melissa, you're invited to the hot seat.
Mr. Chair, just as an addendum, I think it's very important that we have numbers that we can work with. If in fact what Dr. Doloff is saying is true, then we've got an issue, because we are trying to base this off of the numbers that are being presented to us. So I'd like to get some clarification on that.
Good morning again.
Good morning. So with the data, the way the students are identified is that you have to have an IEP. That IEP information is put into our New Hampshire information system for students with special disabilities, our NESSIS system. So you can't, I guess, make up students, because they have to have their SASA, they have to have an actual ID, they have to have an IEP that has to go into the system, and that's where the numbers come from. So I don't think, and they have to have gone through the entire identification process that's done by a child psychologist. So I don't think that the numbers are wrong.
Might I? Go ahead. Dan, thank you for taking my question.
Sure.
It's not meant to put you on the hot seat.
Oh, no, not at all. I'm happy to answer that. Answer the questions with what I know.
Just like any data, there's always a margin for error. And that's not a shortfall on the department by any stretch, but there's always a margin for error. So do you have a margin for error, or do you have an approximation of what you think that margin of error is? Just so we can drill down on the numbers. It's very important for us to have.
The only error would be is if at the school level, they're identifying students and don't have actual IEPs, but when we go in to do monitoring, we look at the IEPs.
Okay.
And for these students, when we're submitting, when a district is submitting special education costs, they have to have the IEP, in Nessus, they have to have a SACID. We check that. So if they're putting cost in, we go in and say, okay, this, an invoice that they're submitting for this student's services, we take that invoice, we go into the system, look at the IEP, and if it says that student gets 3 rounds of speech services per week at 30 minutes and they bill us for 4 or try to submit for 4, we say, no, there's only 3 in the IEP. That's the only part that we are allowed to then count towards your cap. So
I
that,
appreciate that.
that's where I'm
that
not
makes things a
seeing
lot
where we
clearer.
could possibly have a margin of error. It would only be on the reporting end for the school district.
Thank you.
Is there any further discussion of department here? I do have one. When you talk about the department overseeing or monitoring what's going on in the local districts, is this all done by way of what's submitted through the system, or is it actually visitations to the schools? And do you have the staff to do that, to have this oversight, to ensure that, what is being submitted is in fact happening?
So a couple of questions in there. So
Yeah.
first, both. So we're looking at kind of what you would consider to be a desk audit. So there's documentation that's being submitted into our information system. There might be additional documentation that we request for them to provide to us, maybe policies and procedures and that type of thing that we're looking at for each of our indicators that we monitor for. Then there's the on-site monitoring piece. So we will actually go out into schools. Do I need more staff? I always need more staff to be able to make it more robust and make it so that we have the ability to go in and look at every piece of it. With all of special education that we administer through the Department of Education, most of our positions are funded through IDEA. So there was a lot of discussion about IDEA funding, and the bulk of what we're doing in the state is funded with the IDEA funds. I have 1 FTE to process special education aid, and I've got 0.25 of an FTE that goes towards Becky Fredette's salary that's paid for with general funds. That's it. The state is putting in 1.25 FTE for special education through the Department of Education. So if we're wanting to have a more robust system, if we're wanting to have more accuracy with data, we have to invest in that system. We have to invest in the people.
Yes.
Go ahead.
I was just going to say there are states that allow the federal flow through money to flow, all of it flow through to the school districts. So I would concur. I think that the state's really contributing very little, and a lot of the federal funds that could go to the districts are being utilized by necessity at the state level.
Representative?
Yeah, thank you, Mr. Chair. Thanks for taking my question. So I'm curious to know also what percentage would you say of your funding sort of makeup, you referenced that does come from IDEA currently?
Give me a moment to just pull up our latest budget sheet because
While Melissa is pulling that up, we've asked this question before us at Education Policy Committee. The
I'm sorry.
total staffing at DOE is paid the vast majority by federal dollars. It's upwards of 75, 80%.
Right.
Then you have a few people that are hired based upon some grant money that comes in other directions, but the very small amount there above that 80% is that of the state. And so you can see that the department over there is ensuring that they're complying with the federal law, the federal applications that we've sent in for ESSA and all that. And they really, quite truthfully, I asked the question the other day of the commissioner, how many times do you go out to check schools that they're meeting the minimum standards of public school approval? We don't do it anymore. So there be it is part of the issue. You know, it's a significant issue in everything from curriculum of teaching mathematics to special education to career technical education. Melissa?
So with our federal grant for this fiscal year, we received for IDEA $56,713,037. Out of that, the flow through to the LEAs is 32 million. I'm sorry, 49 million. That was a different number I'm looking at. So the 49 million then ends up going 49,154,936. So about
I'm sorry.
49.1.
Someone just 49 million. What? I'm sorry.
49,154,936.
Goes to,
Goes to the locals.
So roughly $7 million is for the department.
It's about 4, 5.
If it's 56 and 49, that's not modern math, that's math.
Yeah. So there's the administrative piece I want to be clear about. So there's an admin piece we've got it at it's less than 1%. We've got it at 0.68% right now. The administrative cost, so you have to understand, Department of Administrative Services takes a cut from that for their own processes and procedures and that type of thing. And then when you have, rent being taken off of that, you have infrastructure. I mean, all of these things, audit funds set aside gets taken out of that. So the actual administrative cost starts to get dwindled down. There's a discretionary component of that that's outside of administrative costs. The discretionary component, those are the funds we use to fund staff then to go out and do monitoring. We try to also then use those funds for particular initiatives like our state systemic improvement plan. There are requirements that we have to meet through IDEA. We use those funds then for that type of programming so that we're going out, we're using funds to go, we give funds to PIC, we give funds to PLACE, we give funds to several different organizations to go and work with our special education administrators so that they are trained, they have mentors, they have supports for the special education teachers. So the discretionary funds, I want to be clear, yes, there's a chunk of money there, but that is all used to then turn around and go back out to help support the LEAs. And we're able to do that because giving an LEA a chunk of money to go, do a mentoring program for their one special education administrator doesn't make sense. It makes sense to give it to an organization that's going to do it for all the special education administrators. So just to be clear, those funds are not just going back to the DOE for us to run operations. It's like very, very less than 1% what we can actually use for that piece of it. And I mean, the state takes a chunk of that away for operations.
Could I ask a follow-up question? Thank you. We were told that previously that it was used to pay rent for whatever facilities.
All of our federal programs, so Department of Administrative Services charges rent for every single federal program. So
Okay.
they're taking money for DOIT,
Sure.
any type of infrastructure and supports they're charging us all for.
So I guess
Phones.
my question is, because the association has historically tried to develop an understanding of the full scope of the funding, is that public anywhere where it goes and what, because I agree with you. I think that, providing something statewide is beneficial. It's just not clear to us, where it's never been really public about how that extra 7 million is spent. And I think that might be something that's beneficial, just making it public.
So yeah, I think it's interagency transfers if you look at what goes to Department of Administrative Services. It's all public,
So
it gets transferred over.
Yeah, and the association's asked previously. It has just been tough to, and maybe it's the way we're approaching it.
And we have to look at it through the budget year too. So when we're budgeting and we go through and we do our presentations to our, Division 2, when we go to, all of the committees to go over every single line item in our budgets, all of that is in there. And then on the Department of Administrative Services, then it's on there and what they're taking in. So the information is there.
As part of the adequacy calculation, there's a special ed figure, special ed ADM in that calculation. Where does that number come from?
Average daily membership?
No, where does the special ed count for the adequacy calculation come from?
So special
come right
education
out of
aid, or are we
that's-
talking about adequacy? Those are
Adequacy.
two. So the adequacy corner, if you're looking at the categories where you have EL students, that percentage,
Where that
Number.
that's in statute.
No. Where does the actual figure come from? So like Mark's department at the DOE does the adequacy calculation. Where does he get that special ed ADM number from? Right from Nessus?
Yes.
Okay.
So they look at the number of special education students. We track it also. So the average daily membership piece of it is like you've got a district that may be sharing a student. So like half the year they're maybe in one district and then the other half of the year. So we break it down by days so that to ensure that the district gets the cost for that student for the time that they were in that district. So that's what it's based on. So it's the number of special education students, and it's done by SACID. So they have to have their IEP in Nessus. That data feeds into our student information system, which is now our ALMA system, also referred to as Index. So the information is a direct feed into that so that those students are then identified, and then you're able to then calculate it based on that.
So and I'm glad that's the case. I want to just have that answered before I said the next part. That number is a number that we use for our community. We feel like that number is a very accurate number for what we have for our special ed identification rate. So what we'll do is we will take that number from the adequacy, from that column in adequacy, we'll divide it by our full ADM, and that's the percentage number that we report out to people, because we feel like a bunch of people have checked that number. Our people have checked it. My office checks it. Obviously, the state has gotten it from where they're going to pay aid out of. So we feel like that's the number. So when we talk about percentages where I am, that's where we get the percentage from, right from the state calculation. So we do that based on ADM. Ours is like 15 for both districts. And so I think that's the best number. So if people were going
There
to
are a
use
number
and
of
it's gonna-
numbers.
Oh, absolutely.
And it's going to be in arrears. So we have to look at, like, once the data's all scrubbed and we're looking at, okay, like any type of an error or anomaly that would show up, like, oh, wait a minute, this student showed up, for 24 days here, but then some of the same days here. The district has to go and correct that at the end of the year. So we're looking at all of those numbers are last year's numbers. They're not this year's numbers. When we calculate IDEA, it's a little bit different because we're using the October 1st count. And that's going to be different than what we're using
That
for
has been a
special
real
education
problem.
state funding.
I've talked with Rebecca a number of times when we've been trying to look at how we fund the differentiated aid, whether we break it down by the 13 IEP categories and get into the involvement of that, or we combine some of them like we tried to do 3 or 4 years ago. And we got two different sets of numbers. I got one out of the special ed department. I got one out of Mark, and they were different based on different dates.
Yes, because they're different pieces that you're looking at. Like, you're going back and looking at what were the costs for special education aid last year. So we want to scrub the data from last year and make sure that the kids went to school for all of those days and that the districts are going to get their appropriate costs. The other piece is, what if you had a student that wasn't identified until this part of the year? So like all of those pieces you want to make sure line up. Looking at last year's data that's clean, that's the best way to look at it. You shouldn't be using an October 1st count because the October 1st count is who was present at school on October 1st, and that's it. That is the number that is required to be used by IDEA, and that's why we use that number. But I mean, they're using that percentage just to look at what our allocation is as a whole. Then when we go through to actually calculate what that district should have, that's different. So I think we're confusing two different funding sources. We've got special education aid, we've got adequacy, and then you get your component, your differentiated aid for that special education student, then you got IDEA. 3 different funding sources, 3 different sets of requirements, perhaps 3 different data sources that should be used because you're looking at different things. That makes sense. All of it together, though, goes towards supporting students with special education. So if you look at the all-in number, I mean, it's quite significant. We spend a lot. We are the #1 state for special education aid, or special education costs in the nation.
Becky, go ahead.
Good morning. Sorry, I might be going a little bit off of this topic, so if there are particular questions for
Grab my water.
Melissa, I would wait. If somebody else has a question, I can wait.
Clarification for the record for Melissa, so if, I'll just wait until she comes back. No, you're fine. If I may, Mr. Chair.
Yeah, go ahead.
Okay. So I just wanted to make sure, since we were talking about numbers in arrears in one conversation, and then earlier we were talking about the federal grant money for the $56 million roughly, and the 49 million and the 7 for administrative costs. That's for fiscal year 26, correct?
So
Those numbers?
the 56 million in the ID funds are federal fiscal year 26.
Okay, that's what I had. Okay, thank you very much.
Go ahead.
Thank you, Mr. Chair. I guess I'm trying to go back to the task that I think that you just asked. I'm trying to look at this list of 13 things and trying to, I guess, work under the assumption that whomever put these 13 tasks together is working off of the idea that these are the things that are driving up the costs of special education. I guess I'm wondering, first of all, if that's everyone's assumption, and that's why these are the only things that are included, or whether these are all standalone things that somebody wants information on. I guess that's my first question to the commission.
Okay, Representative Dry.
Thank you, Mr. Chairman. I've been thinking along the same lines and noticing you asked the question is whether they are grouped, and there are some categories that jump out at you, referrals, comparison of procedures, costs and things. I would suggest maybe as we go forward to give ourselves some homework before the next meetings to maybe go ask some questions, not depend on a person coming in cold to us.
That's exactly where we got to go. We have to get some research done here and have that come out from other folks which are engaged with this, not from us right here, and we'll analyze that information. But there's so much to it. There's even been on some of this discussion outside of this commission, there's been talk about taking all the special education money that's in differentiated aid, throwing it over on the other side of the column into catastrophic aid. And because there's that assumption, some people are chasing the differentiated aid. Rebecca.
So, Mr.
Becky.
Chair, to your point, thank you. Sorry, I know it's confusing with the two Beckys. When I look at this list of 13 items, there are many of these questions where this data exists. I think that it's just a matter of somebody taking some time to list out what is already in existence and pulling it together under these 13 items. For example, I think Melissa mentioned it, but the state performance plan measures 17 items of special education every single year for every single district, and all of that information is public, and it includes things like referral rates, dropout rates, what environments students are in, graduation rates, who's graduating with which kinds of diplomas. All of that already exists every single year for every single district. And every district gets that information, and we can pull that together. It's all on the website, on the state website. So I guess what I'm saying is for some of these things like referral rates and why students are labeled other health impaired, like we have the eligibility criteria for other health impaired. We could look at that. It would probably take 15 minutes. And check that off of if that's really the question. You know, the question of how is that related to the cost of special ed, that might be more of a discussion. But in terms of just checking off some of these things, a lot of this information already exists. The federal and state differences between federal law, state law. The Department of Ed has to send a report to the federal government every year about where our state exceeds special education federal law. It's filed every single year. It's already exists. So we should just be able to ask for that and get that information. I just think it's a matter of maybe listing out under these 13 things where we still have holes, I guess, in terms of what's not available and what do we need to do. And maybe then, in my mind, that would be a place where we would invite people to the commission to ask the questions we don't already have data for. But a lot of this is already in existence, so I guess that's all I'm
So
trying to
Becky,
say.
in follow-up to what you just said, should we not go down through these right now and check off those which we can get that information that's available to us so then we could have that all reported at one time?
Well, I'm just one member of the commission,
No,
but to
but-
me, that would make a lot of sense. I think it would save people
A lot of time.
time and give people some time to look at the data and find out if there are still questions about it. Or, you know, to Jen's point earlier, if there is some sort of question about the data, to give us some time to ask people to clarify that. So we're not getting worked up about getting misinformation and then trying to pick it apart in this commission meetings.
I was just going to say, and thank you, Becky, I would just add 2 items. Rate setting, I think I've mentioned a couple of times, the increase of 5% annually on the cost of out-of-district placements, and changes in the Medicaid rules that have resulted in a decrease in Medicaid revenues.
I think Representative Murray had a question.
Yeah, Representative Murray.
Just one second, let me finish this one thought.
Yeah.
Okay, so my question would be then to you, Mr. Chair, I guess a question for you. Would it make sense that, I think to echo Becky's point, to go through and really just, whether it's on iReport or whether it's, you know, some other place, just identify where we believe that we can get those things and then maybe break them out into either subcommittees or not even subcommittees, but like, you know, a working group that we can just continue to have that and get some members together and get those things rolling so that we can get some of this off of our plates and continue to move on. Because I agree, there is so much to go through. And Jennifer, if I can, you were asking about rate setting data and then changes in Medicaid rules that have caused a decrease in revenues.
Correct.
Okay,
Yeah.
thanks.
Rate setting specifically for out-of-district placements.
Yep, thank you.
Mr. Chair.
Yes.
One of the, I agree, but when I look down this list, there are a number of these that are also, I can see as, you know, a continuum where they connect with things like the Bureau for Children's Behavioral Health. And we established a system a number of years ago that puts people in different groupings. For example, a child's identified with significant issues as a level 5. We don't have a level 5 school in this state. We have a hospital, and we have one level 4.
Right.
And so that instantly means if we classify a kid at those numbers, and we didn't used to do that, they're leaving our state. And those types of things, with the cost increase across the board, and costs go up in other states too, but because we set ourselves up and we pigeonhole people into that number, you now have no choice but to say, well, they said they're a 5, so they have to go to Arkansas. And clearly it costs a lot more there. And I think that's, you know, also when I look at, are there interventions that could be employed sooner? In my work, one of the things I will often look at is, can I involve the Bureau of Children's Behavioral Health for the Fast Forward program as a support for the family? Because it's additional, but hopefully the child makes more progress that way too. And then maybe we're not as reliant on services and supports. And, you know, they've got a 6-month wait. That's too long for a behavioral health issue. And so those things, I think, are affecting it to sort of mimic what or echo what Senator Sullivan was saying. They are definitely affecting the cost. One of the pieces that I guess I'm looking at getting the data is, can some of those be combined and a request made to the Bureau, to Darrell Tenney or whoever it is at the Bureau, and say, can you provide us with what that looks like? How many? I mean, I know that 95% of those students are identified that are going into those programs. But there's sort of groupings of this other health impaired and the out of the placements. They all kind of live together in the same place, and they are driving a lot of costs. And then I know I looked at the transportation costs from our last meeting, just blew my mind. I have to be honest. I was really shocked at the cost of things. And even when we're not going residential, when we're transporting a kid an hour to each way, it's just, how that's not sustainable. But I would like to see us, maybe look at some of those other health impaired, behavioral health, like, is that all grouped together? And I know that you ask in here about increases since COVID school closures, but I think the tail end, what's related to that is also the increase in behavioral health issues since the isolation that was the pandemic, right?
They're all tied together. I mean,
Right, and I just think that drove some cost here for the other health impaired. We have people that had maybe stabilized conditions who were then isolated for a year and then said, oh, come back to the world. But I see those kind of all in line. We've made some very rigid rules about things. You know, that side of the piece is also, they're very constrained by finance, but I think just knowing how they relate would be important to say, what are we doing? And the piece that I will say is, again, I think I said it at the last meeting, when we say local district costs of placement, and if other options were available, our neighboring state to the south, and I'm not going to promote them, they do a lot of these collaboratives. And that cuts down on transportation. It cuts down on the cost of big private school placement. And it's, you know, those are things that I think that the committee could look at and say, no, they're usually 2 or 3 districts get together and they kind of do it. They're looking at one in my area of the state. So I'm going to shut up, and I promise not to change my name to Becky.
Okay, no, thank you. So I'm going to let Melissa's been trying to respond to some of this, and I'd like to have her do that. One question for you, though, to begin with. We spend on every one of these children that are those 800 plus that are catastrophic, 840, 860, whatever it is that's above 70,000. We spend initially $70,000 each district on that child before it's receiving. So if you multiply the 70,000 times 840 kids, you're talking $58 million right there. Then you have the catastrophic aid, which we're appropriating, and that is another $50+ million. But we're spending $977 million. Is this the answer? Or are there other drivers here? We have another huge amount of money that we're not accounting for.
So I just want to make a clarification with regards to DHHS. When we're talking about students that are placed for an episode of treatment or a court order placement, and they have an IEP, those students are not included in your special education aid. So just want to make that clarification that we're lumping them together like it's a placement thing. It's a placement, but the episode of treatment, that's a whole separate other cost. I mean, once they reach cap for court order placements at 3 times, then we go ahead as a state and we cover the rest of those costs. Episode of treatment, and there's not even the cap. So we're paying for that episode of treatment completely. Those kids are not included in the 800 and plus that we're talking about for. Those costs are taken out and separate. So just to make that clarification.
I had
One question I have is, should that episode of treatment go like 5 months, 6 months into the school year, and then a district elects to keep a student in said out of district placement at their expense for the remainder of the year? The episode of treatment ends because right now they're dating them at 6 months, and it's to get an extension it's hard. So if a child is placed there and then it's March, from March to June, where does that money come from?
That would count towards special education aid, but we don't. I mean, we looked at the data. We really don't have. These kids are placed in the episode of treatments and the court order placements for years. They are calling it temporary, but they're not. Those kids are in them for years. I pay the invoices, so I know. I mean,
Yeah.
it's significant. The costs are significant, but that's a separate pot of money. So I guess if we go back to the original, we've got IDEA, special education aid, and then we've got adequacy in your court order placements and episodes of treatment are over here. And the state's paying for those costs. So
Yeah, it's like there's a lot of pots, as I just heard here. And it's-
with a different formula and set of requirements and that type of thing.
Yeah, Dwayne.
I think I'm going to go back to what you said, something about that there's a number of costs and students that are not part of the state special ed aid calculation. And that's 100% accurate, right? We have, and I don't want to give you the exact number because it's so small, but in Bow, we have less than 10 students that qualify for any kind of state special ed aid, catastrophic aid. And we have 220 identified students. So the vast majority of the costs that we're going to incur are not even going anywhere near state special ed aid.
That's what I'm
They're
driving at.
correct. They're the day-to-day costs
Why is it?
that are associated with, you know, all those different students and the programs that they all have. The vast majority are in district as well. We report out all of those costs in a number of different ways on the DOE 25, elementary, middle, high, you know, by level, but they're all consolidated costs. They're not broken up by any kind of identification or anything. But we can get more, I think this is true. I don't want to speak for Mark, but we can get more data. So like, for example, on this list is the cost of out-of-district placements. We report that. Elementary, middle, high, we report it by public school, private, residential costs, and the public academies and JMAs are on there as well. You can get more granular detail on how much out-of-district placements cost and whether they're elementary, middle, or high, or where all that money's going. And that would be good to know because I have no idea. I know what mine is. I know what our two districts' costs are because we report them. So there's a more data that we could get, more detailed data we could get, I think.
Who do we contact, Dwayne, to get that data?
I think you would contact the Bureau of
It's all
Finance.
reported on the DOE 25,
Right.
so it's all on the website, all the information, all the cost for special
So we
education,
would
everything's on the
go
website.
directly to
Our website.
Nate Green on that?
You could go to Nate Green on it, or just go to the website and,
Yeah.
yeah.
Well,
It's in the iReports, right?
Yes,
Yeah.
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 I mean, I think we got this sheet, the committee got this sheet a while ago, and it was, you know, kind of consolidated. But, I mean, you could, under related services, you could break out, all the tuition costs are going to show up in related services, because that's where they're reported, because they're a related service object code. So you could break those out, and so you could determine, okay, of all the related services, this much is tuition. This is out-of-district tuition that districts are paying throughout the state. I would be interested to know what that number is. And then transportation's also broken out, elementary, middle, high. So
Becky?
At the risk of giving myself too much homework, I would be more than happy to attempt to try to put something together that people could give feedback on in terms of what data already exists in each of these 13 items that we could add to what data is out there, and maybe what are other agencies or departments or groups that are involved with that particular item, or what questions or data needs do we still have after we've looked at whatever is already available. I would be happy to try to make a skeleton of that so that we could go through it in a way that is more, I don't know, sequential, I guess, or systematic, so that we could, or group them together. I'd be happy to make a run at it, I guess is what I'm saying, over the
Is
break to
anybody
try to
opposed to
help.
Becky doing that?
No, not at all.
Go
And I'm
for it.
happy to I'm happy to help or whatever's necessary.
You're welcome.
Senator
I'll just
Sullivan.
attempt it. It's not gonna be perfect, but I'll give it a shot.
That's okay.
So I think the one is the one of the 13 that's going to be the hardest maybe is number 8, the local district cost for out-of-district placement, and if other options were available. How do we? Okay.
I think, did Dwayne have another question?
I do, but it's
gonna-
done with that.
Yeah, that's a really challenging situation to really pull apart because everything is made based on a team determination. And it really depends on whether a district has the resources to develop programming and whether they don't and they need to send kids out. So it would be very challenging to tease out what's available. And I think it would be interesting to see maybe how our state compares to other states as far as out of district placements.
Representative Rye and then Becky.
Thank you, Mr. Chairman. Representative Damon and I took a field trip up north last month at the request of one of the superintendents and visited a lot of one district up in the North Country, and just the general conversation, always special ed always comes up as a cost driver there. But we did float questions about whether regional things could happen. And that's I think in the mind of a lot of people, but I haven't seen it ever written anywhere or put together. But I think that many people are coming to a similar conclusion, but that nothing's been done to bring it together. So I just wanted to kind of plant that seed that there are a lot of other people talking about the same things that we're mentioning as we go through this list.
Becky?
I would just add, as part of what we're going to try to put together, if other options are available, I think that might not be exactly worded in the way that's going to get at what people are asking. It seems, teams are making that decision, to Jen's point, based on what they feel is the least restrictive environment to meet that child's unique needs in light of their unique circumstances in that moment. If there were other things available that were less restrictive, the team would make that decision. I think if they're looking at an out-of-district placement, they're making that decision based on the fact that that's what the team feels the child needs. But it would be reasonable, again, already exists a list of private providers and private placements in our state that are available, what codes in terms of categories of special ed that they serve, what their rates are for all of their services, all their tuition, that's already all on the Department of Ed website. It's all accessible. There's a private provider directory as well that will list out what kinds of populations of students they serve and things like that, whether they're a day placement and residential, whether they're just residential, all of that exists. So if you're looking at geographically what else is available, that might be a more specific question. Or if you're looking at, out of our 13 disability categories, do we have a hole in terms of resources that are available for certain students? Is it a, other agency kind of resource issue? Like the behavioral health, is that the issue that's leading to that? But in terms of if other things are available to get to Senator Sullivan's place, in what way? I get, that's the question, I guess.
I got a follow-up for you though, Becky. If in fact I'm in a small district, 150 kids, 100 kids, and I have a student come in who is a very high needs student, $250,000 type kid, and I have a staff around me that's about 6 or 7 teachers total. And I might be fortunate enough to have a full-time resource room teacher or a special education teacher on board. I have to contract services for everything else. And yet, when I have that IEP meeting, what type of guidance is that IEP team meeting getting from the Department of Education in terms of the special education? Is here's your options that might be available. We recognize you're a small district and you don't have a hot clue how to handle this.
Well, thank you for that question, I guess, Representative. If a student comes to your district and is not starting from the referral phase in your district, for example, they move in with an IEP, the IEP team is obligated to take that IEP and look at it and talk about how they can replicate that to the best of their ability in the same type of setting as what the agreed upon IEP requires. There are some districts, again, it kind of goes with, I think, whether or not you have the capacity, to your point. If you already have an in-district program that meets that child's IEP, then that's sometimes a much different conversation than if you're a district that doesn't have that.
You just said they're obligated to, and now
You have to accept their previous.
I've worked with the people in the military coming in and all that, and that have IEPs, and we have agreements for that in statute. But I'm really concerned that just because something was occurring in the previous district in Arizona or Pennsylvania, that we're going to have to do it here in New Hampshire, we may have a better way of doing it.
Well, we may, but when that student shows up, you don't know that child, you don't know that family. Your
So-
obligation is to implement the IEP that they bring. And again, this is where New Hampshire, because we categorize students differently,
I
because
guess
our
people are
eligibility is
missing my
differently.
point here. What kind of support do they get to?
Can I respond to that?
Yeah.
So I think, as mentioned, the DOE is pretty shorthanded with all the work that they do. We actually have an infrastructure of support for each other. Not Ceresk, the association, Ceresk was on my mind because Ceresk is the closest thing New Hampshire's had to a consortium. Many of the districts, and I've worked in a couple near the border, send students from New Hampshire to these consortiums down in Massachusetts, and the costs are pretty reasonable comparatively to New Hampshire. So that's, really appealing to do that. I do think there's a potential for doing that in the state of New Hampshire. The point I was going to make was that the association has a group that is that is out of district coordinators. So they're sharing with each other all the detail on who they're transporting. Districts get together and say, I got to transport a kid from Manchester to Nashua. Who's got a bus going that way? So it's really, there's a structure in place. It could be more robust, certainly, but districts do work together to try to reduce costs in many different ways.
We've done this with our nurses as well. They'll call to get support, but are we missing something here, though, that we're letting these local groups handle this? And do we need more oversight from the Department of Education, which has some approved programs which are reasonable that we'd recommend that you utilize? Think about this at your IEP meeting.
We only utilize programs that are approved. We're really only permitted to use the ones that the DOE approves, unless a hearing officer tells us to place a child somewhere. So we really do work collaboratively together as far as that goes.
Melissa?
And I believe it legally, we cannot place students in an unapproved program.
Well, everybody has a hand up.
Yeah, thank you, Mr. Chair. So, the experts have spoken and well received, and we're hearing all of this from this side of the table. My big concern is, what is other health impaired? I don't see any definitive list on it. I would like to be able to drill down on that and see exactly what diagnoses fall under that category, because this is where we are seeing.
Can I respond while we're passing this out?
You know what? I'm not even gonna ask my question. I'm all done. Thank you.
Well, I think you're getting an answer right here.
Yeah.
I think this was a task Becky Fredette might have been charged with at the last meeting to provide some sort of information on the other health impairments. So she did send me a little bit prepared to come in her place and ask me to provide this to you. So hopefully, I know maybe take a moment to look at that. But that is something that was put out by the Technical Advisory Centers through the U.S. Department of Education for 2024 to help states.
And Chairman Ladd, just as part of that, an additional piece, the eligibility checklists or what questions the team has to answer in order to identify a child as other health impaired is also available. And I will put that on the list. I have that here. If anybody wants it right now, I have it here, but
I can make copies. Thank you. Chairman Ladd, may I? While we're looking at things too, I just want to make sure that we are also, when we're talking about placement, and I understand the concerns and the costing, that we're being mindful also that when we talk about students and their local communities and being a part of those local communities, that it's really important to be mindful that our learners are in the communities where they reside with their peers as much as possible. And so to that end, sometimes when we talk about LRE, that's a factor as well. So I just wanted that to be clear.
Yeah, Tim?
I just wanted to kind of follow up on what you were saying on the out of state or out of area IEP that shows up and you've now got a student. So my office, and obviously my office consists of me and a part-timer right now. One of the practices that I've done is said, look, we're gonna have them roll out what's been going before for 3 months.
Right.
To get to know the kiddo, maybe some new assessments, because the team will say, they did this and this, but we think maybe this evaluation would be appropriate. And I encourage parents to do that and say, let's come back to the table in 3 months after the teachers, after the BCBAs and all these folks get to know your kiddo a little bit, because it's not a matter of reducing what they get, but as you said, maybe we can do it better. Maybe we've got a better idea. Maybe we've got a particularly great provider in that area that is somebody we want to bring in. But I'm touching a fraction of those cases. But when I get them, I kind of, that's my practice to advise people to say, let's come back in 90 days after they get to know them and say, is this the right thing? I mean, I think we do a good job.
Them when they come into the district. I mean, isn't the goal of having an IEP is to work up to progress and goals, so you don't need an IEP? I mean, it would make sense to just reassess them automatically if they're coming into a new district, new environment, and new situation.
Yes and no. Sometimes there's some resistance to poking and prodding the kid too much when you first get them. Like we want to build a little bit of a rapport with them.
Yeah.
And sometimes if I see, for example, in my work, if I see that a triennial evaluation is going to be due next year anyways, the student services director and I will talk about it and say, is it really appropriate to just, let's do it now. Let's step it up a year early because he's come to your town. It's new. You know, there are things that do affect it culturally and regionally. So that does factor in. I think the tougher situation is when a child comes from a placement back and you're kind of trying to go, we can't replicate that here. That's not what's done in public schools. So those times I think I probably do say, we gotta look at some immediate assessments. But for the most part, it depends on the situation. I think it certainly depends on the kiddo, because if you have a child that is very fatigued easily, you don't want to hit them with too much too soon. I will say that we get a number of the same things and the same age group. And so I'm starting to really look at those trends and say, should we, when we get a student that comes in with an autism profile, be looking at what was the progress? And unfortunately, if you have a student that came from a prior district and no one has any progress reports, either the district didn't provide them or the parent doesn't have them or whatever, you really do have to do some new assessments because nobody knows where we're at.
Thank you. Thank you.
One of the questions I've had, and one of the reasons why I said I'd be on this commission, is that the costs of special education are increasing significantly. And I'm trying to figure out in my mind, what are the driving forces for these costs increasing the way they're doing? And we can't continue like this when $1 out of $4 going to education is going to special education. And I reflect back on times that I was a teacher, then a principal, then administrator, and things have changed in the last 50 years. And when I first got in the business of this, there was a special education room. There were resource room teachers. If you had a disability in language arts or reading, you went and got that instruction for that period or for that period of time that's in the IEP outside the room. And we didn't have as many paraprofessionals floating around. We used to call them teacher assistants, teacher aides. And now we have them everywhere. So what are the driving forces here? Is it because the way we've structured and interpreted least restrictive environment? Is it what? Because I don't think that our real driving costs are here at the upper end. I think the costs are with the student that's in that $0 to $70,000 range. And there be it, how do we address that issue? The costs they're skyrocketing. And everything is shooting so high, I don't know if we're going to be able to maintain it. We aren't, and I know that we're looking at lawsuits, working on all this stuff, and I'm going to be dealing with it next Monday. And unfortunately, I don't have the answers to that. I don't have the Holy Grail in front of me. I don't have a magic ball in front of me. But I'm concerned. Becky, your hand's up here.
Thank you, Representative Ladd. Can I just ask a clarifying question? So is it your belief that when we were pulling students out to give isolated services as opposed to push-in type of services or inclusionary practices, that met students' needs, A, and B, was also less expensive?
No, not totally, but it was
Okay.
there. When a person came back to the classroom, you had teachers that would look at the learning style and the teaching styles, and they would work with students. They present the content at a level and in a way that that child was feeling very comfortable and learning, and I believe becoming more productive as a student in our society. I don't have the knowledge right now to say what we're doing right now because I haven't been in a classroom now since I've been down here in New Hampshire. But it seems to me that the costs, are we netting what we want to get from our dollar with the process we have right now?
If I could respond, yeah, we're still pulling kids out just as you described, and in some cases we're pushing in, and in some cases we've got programs. I really think after doing this for a very long time, you're going to find that it's like a million little cuts. Costs are going up in every arena. There's fewer and fewer people going into the fields. It's a very challenging field. And so we're having to contract. Contracting a para is considerably more costly than hiring a para. So transportation costs are going up. As I've mentioned, out of district, every cost is going up. At the same time, it's harder and harder to recruit staff. But at the same time, students are more dysregulated than I've ever seen in my entire career. I mean, and there's a multitude of reasons for that. And I think, so teasing this out is going to be very challenging. When you've got explosive kids that, don't want to live any longer. I mean, the complexities are just breathtaking as far as what's going on in children's lives and the number of kids with anxiety, attention deficit, and those sort of things. I think it's probably a bigger charge than this commission can really answer. But I do think there are some solutions that may address some of the cost issues.
Further discussion here on this?
May I just point out one thing?
Who's talking?
It's me.
Oh,
For number 1, student referral rates by category, we only have the categories once they are identified. So if you have a student that's referred but not identified, there's not going to be a category for that. So I just wanted to clarify that. But as far as students that are referred and the rates of referral, we have that data. And then the students that are referred and then the category for which they are identified, we have that data. That makes sense.
can we get a hold of that data?
Yeah, it's all on our website,
Okay.
everything.
You're going to get that for us, Becky?
I will work on that.
Representative Ladd?
I will work on either putting a link or something so that we're not printing 8 trillion pages of things, yes.
Because you're able to see that by district, so that's the piece. I mean, there's the statewide data that you can see, but then there's the district level data, so.
Thank you.
District level data.
Dwayne?
You might not know this, but the number 7 and number 12, the charge, do you know what those were specifically asking about?
Number 7.
I had questions about those too. So the reporting of special ed costs to the department and then the use of insurance for legal services?
I wasn't in one of those committees where this even was developed. It came out of ed policy and then went to the Senate and it was combined in the Senate Bill 57, and they combined both the consolidation and this bill into it.
I can
And
answer,
I think some of this came back a little bit different from the Senate.
I can answer that because I am on ed policy.
Okay.
So, and I, Dwayne, I can answer this for you as well. So one of the drivers of cost with special ed is districts having to retain legal services when a parent or a guardian lodges a lawsuit against a district and goes through process because an IEP is not in compliance. So that's a cost, and whether it's to the parent or to the district, the property taxpayer ends up on the hook for those costs, even if the district is victorious or the parent is victorious. So I do remember why that was put in, and I actually think it's a good metric to look at. Because as we see what Dr. Dolev had stated, if we're not having enough professional staff to carry out what's allegedly to be implemented in an IEP, then that leaves the district open to lawsuits because the IEP isn't being met. So that was something that we were concerned with, and I think it's something to look at.
What happened to the special education advocate that we put into law here to try to, I'm saying, to try to save us those dollars? We had parents coming and saying, yeah, I'm spending $60,000.
It's for the parent, not the district.
Yeah, but that parent was supposed to use that organization over there to do this now.
Well,
So can I have a little bit of knowledge as to this gentleman's job. And I will say that he is such an advocate for parents and families, but he is often deterred by the districts who are not helping these families and listening to the advice that he's giving. So again, we need to go back to the school environment and see what's happening. The thing that troubles me the most is I keep seeing attention and hyperactivity and excitedness coming up as a disability for kids. And I think we actually need to look at how we're teaching kids and find out why all of a sudden we have these problems. I mean, part of it is the schools were shut down for a year. Kids forgot how to socialize, they forgot how to do things, and then they were popped back into these environments without any kind of way to gradually, we told them that they were deadly. We told them that if they were around adults and their teachers, they would kill them. And then we put them back into an environment and said, okay, you're good now, let's go. And we expect them to just adjust. The biggest lie adults tell is that kids are resilient. They're not resilient. That's an excuse we make because we're lazy when it comes to them. So when we're looking at this stuff, I'm sorry, it gets me really upset to see what we've done to children. And these are, we need to not just keep looking at them, but we need to reflect back on what the adults are doing and the decisions they're making and how they're labeling kids and figure out if there's a better way to make these environments better and the way that we're educating them better. Thank you.
Mr. Chairman?
Yeah.
I want to speak to the lawyer piece because it's half the time that lawyers are coming to IEP meetings that I'm at, not just dispute resolution. They're coming to the IEP meeting. And I often get the question from parents, why am I paying with my tax dollars for them to have a lawyer there to beat me up? And I try to explain, well, they're not there to beat you up. Sometimes they're there to have people do the right thing. And I don't, I like those lawyers, by the way, they're nice people, but that's part of it, is that the lawyer, it's not just the dispute resolution. They're there a lot and they're there advising them on other things too. Rochester, Claremont, these type of places that we've seen in the newspaper, the lawyers are very deeply involved and the parents are saying, my tax dollars are paying for that.
what you're saying is they're not working pro bono.
Right. No, and but the parents are saying my tax dollars pay for a lawyer that is working against my interests, and I don't know that that's entirely right, but it is part of it, and there do need to be lawyers. It's complicated stuff, and I just think that we try to avoid, and I will say we have avoided since last fall, any due process filings out of my office, and I'm pretty proud of it. And it wasn't because there weren't cases with merit. It was because we're determined to solve something if it can be solved. And I want to give some of the special ed administrators some credit for working with me on that to get it to, well, we just reached a resolution on a case that I would have said no way a year ago, and it's solved.
I just want to add a different flavor. I've been in IEP meetings, since September, and there hasn't been one attorney involved in any IEP meeting. So I do think once the state advocate is involved, there may be attorneys involved. I think some of the districts are trying to protect taxpayer money as well. I mean, I had children in the schools. I would have loved a private facility for each of my kids, but there's parameters as to who can, what placements are warranted and what aren't. So I don't think that it's necessarily that districts are fighting against parents' best interests. They're also advocating for taxpayers and what, the purpose of education is and what the purpose of these placements are. And it's rare that you see an attorney at a school district
Tim, you questioned Romans 7. Was there, there were two Roman numerals. What's the other one that was?
Yeah, I was just 7. It's just
7.
reporting of special ed costs to the department.
And 12.
12's been talked about.
Okay, yeah, use of insurance, yeah.
I didn't know exactly what 7
Yeah.
means.
So because we're at 11:30 here, working down, Becky, you're going to get some information. Can you try to review a little bit of the Roman numeral areas here, which you might encompass?
Well, sure. I mean, I guess off the cuff, my way of approaching this would be to list out each of the 13
Yeah.
questions, make a list of what data already exists or
Okay.
programs that are associated with each one. If people have other ideas like behavioral health and things like that, we can add all of that in. Other agencies or departments or programs that are state run that are involved in each of those. And then what questions or needs do we still have about those that we maybe neither need to have a conversation with people or gather more data some way. I mean, it just seems to me like that would be a reasonable way to at least start and be able to prioritize moving forward sort of how you want to go at all of these topics. I mean, or maybe there's some categories, like the legal services or something like that, where it's so granular. Perhaps that's something that we gather outside of these meetings and just share, as opposed to having a conversation trying to nail down the exact cost of legal. I mean, that's just an example. I'm not saying that's what we will do, but just some sort of idea of trying to prioritize where we need to have more conversation or have people come in and speak to the commission or gather more data versus things we can say, okay, well, we have this information. What it means about the cost in the state, I think that's a conversation that would need to happen, obviously, or where the state has some influence over some of these things versus where maybe there's some federal aspects that perhaps we don't have influence over at this moment.
Or maybe ways that we could help with legislation to streamline this process so it isn't
Perhaps.
so egregious and subsequently there might be cost savings in that. So
Or places where the state has decided to take certain action or have certain programs available or what have you, and what is the impact on some of these things?
Right.
Where have we exceeded the federal IDEA and what are the pros and cons of that?
Right.
There are some ways in which New Hampshire has exceeded that I think most families feel very strongly are beneficial. I don't know that people would want to take those away necessarily, but that is, what we've decided. And
Is there another area I'd like to look at? And I think Senator Sullivan mentioned the issue of bullying and mental health earlier in this session today. But I can recall when I was a school principal, I saw that starting to happen. And I invited Community Mental Health, which I was also on their board of trustees at Community Mental Health, to come in and have an office in my school. And I also had a school psychologist on staff and guidance counselor. So now we're dealing with this as teachers in schools because there's a huge issue in our society on kids. I have a daughter who, and Becky, I have a daughter that's a life skills teacher, special ed. And she's been thrown downstairs. She had a hip operation as a result of that. She's had a student that was just misbehaving, throwing file cabinets, everything around the room, chairs around, down to the principal's office. The principal calls mom or dad up. It was mom that came in. The kid's going nuts. They decide to call the police. The police come, and lo and behold, mom shows up and says, "You be a good boy and I'll take you to Dunkin' Donuts." Kid changed right there on the spot. So where are we between IEP and behavior, and how are we utilizing our guidance counselors and those people in our schools today? Or are we not utilizing them the way I just, mentioned I had previously used mine up there while I was in Alaska? And is that something that special education's catching those costs for behavior, which is not an identified necessarily emotional handicap? It's something that's controlled by environment. It's controlled in the family, the home.
Therapy outside the school.
So, Reps. Murray?
Thank you, Chairman Ladd. I agree with some of the questioning. I also just want to be very careful. There are actual clinical diagnoses for behavior, and while we might have certain components, there are things like oppositional defiance disorder, which is not something that is just somebody's behavior. There's more of a component to that. So I think we need to be very careful.
I get that.
Yeah,
I get that.
and I hear Senator Sullivan's point. I think the two of us have co-sponsored bills on recess in separate chambers, so we're talking about that differently. We'll see where we go, but I agree with the intention of getting kids out and moving and being outside. So,
Are our guidance counselors getting involved with this? Or are they more involved with finding a pathway for a kid to go to college, or dealing with other disciplinary type issues? Where are we on this?
We can drill down on that. That's a big, that's another committee.
I guess so.
Well, it's costing us money in this too.
Yes, it is.
But I think that's a, sorry.
I know
Sorry,
it's
Mr.
huge.
Chairman. I think
Victoria, I know that it's huge, but
Yeah, and I could go on all day. I won't, but I could go on all day about my perspectives on that and how I watched it change in the schools. From kids having so much more time to be outside, moving around and socializing, to be really put in a seat for 6.5 hours a day. And, this is since 2014. This has been happening and I think if we look at the numbers, we're going to see that this really started to amp up after Common Core came in and the rigors that came in.
I agree 100%. There was a great New York Times article recently about the school's role in children's dysregulation. We've put a metric on everything, and the pressure for testing, the amount of time kids are on devices at home and at school, the decrease in recess time since No Child Left Behind came along. I think this is one area we can all agree on. We need to change the way we're focusing on schools, and we're putting so much on test results. The pressure is hitting everybody, the kids included, and I think more recess time and outside time would be a dramatic change.
So on that note, I hope you guys all come testify if I give myself a plug. I have a bill in for mandatory recess. Recess cannot be used for punishment, and also for play-based learning, not only just K, but expanded to K through 3. So I hope you all, that's my plug. Sorry. Thank you.
I'd expand it to K through 4-5.
I would love to do that, but Manchester made the decision to put 5th graders into middle school, which is really a whole nother
Oh, in my town, middle school's 4th grade up.
crazy to me.
Yeah.
But,
nuts.
Mr. Chairman, I do want to say real quickly, you mentioned having therapists or counselors come in the school you were in. I
In an
think.
office, in the building.
So
where they
we have
come over.
districts in this state that refuse to let that happen.
We have guidance counselors. I'm not sure. So I think that there are times, what I think you're referencing is when parents want to bring outside therapists in, perhaps. But I want to assure you, there are school psychologists, there are guidance counselors. New Hampshire has a critical shortage of therapists outside the school. Parents can't find psychiatrists or therapists. We encourage them sometimes to go down to Massachusetts because there are none. So there's nobody refusing extra support. I think if it's a confrontational situation, there might be some disagreement, but we're looking for all the support we can provide for students. I'm not sure what that is from.
One of our biggest districts in the state refuses to let any outside provider enter any of their schools, period. Full stop. BCBAs, RBTs, therapists, you name it. They're not allowed in.
So
Or
RBTs and
parent,
BC.
or parent volunteers.
Agencies are making a lot of money off of kids, and many of these large corporations are looking to send BCBAs and RBTs into the public schools.
What's the acronym for?
Oh, board certified behavioral analysts and RBTs. They're covered by insurance now. So these companies can get more billable hours by sending them into the schools. The schools are obligated to focus on students and their IEPs. Bringing in private agencies, it's very challenging. I think districts are contracting when they need to with outside agencies, but having somebody come in from the outside agency that's profiting off of students and their disabilities doesn't make any sense.
A lot of times things are just not the child, but it's also family involved. And when you can have them working together so the student doesn't have to leave the school to go get that support, and the parent can come in and be part of that team, I saw tremendous success.
So both Nashua and Manchester have sites for mental health providers from the community coming
Okay,
in.
good.
I don't know what this is about. Large districts. Those are the two districts that get the least funding from the state and have the most complex needs, and are struggling just to get by. So they are utilizing all of the resources the state has to provide and the district can finance.
Becky?
Thank you, Mr. Chair. I'm with complete respect for everyone on this commission and for the many times I come before you and other avenues in this building in downtown. I think this particular conversation needs to be overlaid with the idea of some of the other legislation that has happened over the last several years and the conversations that happen at committee meetings about the intersection of students' mental health needs and the school's role, and what schools should and should not be providing, and how this conversation overlays some of those other conversations. I'm a very heartfelt person. I did special ed work for all of my career prior to this role. Working with families who have students who have very significant mental health needs also sometimes means working with families who have very significant mental health needs. I think that is a delicate conversation that you need an immense amount of trust between the school district and the family to have these conversations about what kinds of supports you're giving to kids during the school day, about the other priorities that this legislature has laid on top of schools also, and trying to parse out whether helping kids with their mental health needs in school is moving other academic needs also forward, or whether it is a separate thing that should not be happening during the school day. I think it's very complicated, and I think this conversation is complicated. And if you're looking at individual districts and who will and will not allow certain things, there might be lots of reasons for that, and I would just be really mindful of painting a broad brush over why every single kid perhaps isn't having access to something like that. It may very well be a really unique situation, but having sat with families and talking to them about their children's, for example, bipolar disorder, and having a family who the parent also has bipolar disorder, and watching them realize that their child is going to struggle the same way that they did is a very hard conversation. And I think trying to talk about the school's role in some of those things is a difficult conversation. So again, if we're going to go into the whole, talking about are people trained, not trained. If you have new special ed administrators or new special ed teachers trying to run a meeting with a family whose entire family perhaps struggles in that same way, some of those meetings are not going to go the same as if you have a well-seasoned administrator who has worked with this family for 10 or 15 years with multiple kids having this conversation about their fourth child. It's a very different conversation. So I just caution everybody to look at sort of the intersection of all the things that have happened in the education committees on both chambers over the last several years, and some of the messages that schools might be getting about this very issue, and trying to now, in some ways, paint this idea that schools are intentionally, refusing things. Yes, I'm not saying that might not be happening. However, I think there's also some other factors that schools might be trying to figure out where the line is and how to integrate all of these things. Thank you.
I
Sorry.
think clarification too for the department on what's our role in that, because I think we also struggle with understanding, are we supposed to be implementing MTSSB into schools. You know, the funding for that was coming from the federal grants, you know, that funding is gone. Is that a priority? Is that not? So I think there's some clarification too on our end that, you know, what are the priorities of the legislature? What do they want us to do? That will help us then to kind of direct some of the programs and services on that end as well.
And there is a bill in this year to remove MTSSB completely from schools.
Well, you know, that's, you know, for me, that's, when I was given that title of this distinguished national principal up in Alaska, I was given it because I initiated intervention teams and had this situation in schools where I invited mental health into the schools and had a room. I had alternative school in the school. It was a situation where we had real community involvement, and the achievement scores for the school were very, very high. So, you know, I think that intervention, I'm going to bring that intervention policy I had back in 1990 something, and it worked. And you don't necessarily, you know, I understand the MTSB and how that works. You know, we've heard it in the policy committee, and I've seen it work in schools, and I think the program is solid. That in fact we need to have this process in place to help students, and so we don't. And I was able to steer kids in the direction of not having to have an IEP. And we were able to go the other direction, which we wanted them in through that program. So it's I don't know, you know, the how it's being interpreted or used today, the MTSB, the three-tiered system. But I know the system I had worked. And so we got to get back to that. I'm going to bring that policy in the next meeting here, because I think intervention is something where we can save some dollars too. Put a little bit here to save all this over here.
Well, to your point, Chairman Ladd, there are some eligibility categories that require that the school has tried other interventions prior to moving down the road of eligibility for this very reason, to ensure that for most schools who are high functioning, who have a strong intervention system, by the time you get to identifying a student, you should have vetted out things like, is it a mismatch between teaching style and learning style? Is it the fact that that they just don't get algebra, or do they actually have a math disability? Is it any of those things should have been far vetted out before you ever by the time you get to eligibility. Most teams should feel pretty confident in that decision. So that.
Do you think that's happening in all our schools?
Thank you for the question. I certainly don't want to speak for all school districts. I mean, it is a best practice, and there's some legislation that requires it, quite honestly, that is in effect. I think, again, there's many things that could factor into that in terms of resources and
We have a
things
lot
like
of
that.
legislation requiring things. You get your IBAS reports in when you're supposed to. It doesn't happen.
I think
Maybe the question is, why is it not happening?
I think districts that have the resources to provide interventionists provide intervention. I think if a district doesn't have the resources to provide a robust tier 2 intervention, they're not able to. That's the reality. It's costly to have a really effective intervention system in place.
I think that schools struggle to implement multi-tiered systems of support. And we're not just talking for behavior, we're talking for academics, which is if you improve tier 1 first, which is instruction for everybody, we focus on improving that, that's going to then be more effective down the road when we're looking at identification. If a school has a strong multi-tiered systems of support so they can have the resources to then handle those students at the tier 2 level, then we're going to see decreased referrals. So that's one thing we can do for this whole big picture.
And have good leadership in the schools and good supervision in the schools. That's, you know, there's a lot of parts of this equation here that if you have a good principal in a building that's on top of instruction, rather than devoting all their time to some other task that's getting this paperwork down to Concord or the discipline, you know, being proactive and
Instead of reactive.
yeah. So I guess I've said my part here.
Good job.
But anything else for the docket today?
No.
No. Thanks, Victoria.
Just for clarity here before we move on, if I may share. Our next steps, is Becky taking this on by herself?
I'm happy to make at least an attempt at something to bring to the next meeting, whenever that is, assuming,
Okay.
I mean, I know after we get back in January, that it will be a crazy schedule, so I can't imagine when we're going to actually schedule this meeting, but I'd be happy to try to have some sort of skeleton for the next meeting to at least work off of.
Is that something you could send us links beforehand? So we could look at that.
I'd be happy to send them to the chair or to Jen.
Melissa, thank you very
or
much.
whomever.
Thanks,
I don't.
Melissa.
Thank you.
I'm still not getting the commission emails, so I'm getting everything secondhand through Jen. So I'm happy
Oh,
to
you are?
send it to whomever.
Jen, how do we,
Oh, she's back there. I was looking.
are, pardon me, I can't hear you.
Something to send to her office, have to program in to get it directly to her.
So
I'm happy to send it to the chair or Jen, and she can distribute
Give
it.
me your email address, I'll personally forward it.
Oh, thank you. Representative Ladd and Jen have been great about trying to get me things, but I'm happy to send it to one person who can distribute it or to everyone, whatever is easier.
Jen, which is the best way that information be funneled to you so then you can get it out to the commission? I think that's a way we ought to do it rather than going singular here or there. So
I don't only
everything,
do it for Becky, everybody else is on there.
you're welcome to contact anybody on the commission members. But I think that if there's information you want to share, have it go to Jennifer Four,
Yep.
and then she will distribute it.
I will start working on that, and I will try to get it to you the week before Organization Day.
The week before Organization Day?
After that, you have hearings scheduled the following
That's a
week,
lot.
so I will do a skeleton. It's not gonna be, I mean, again, it's
right.
not one person's work. I'm happy to start it and try to get something out to the commission before the 7th.
Sounds good.
Okay, thank you very much.
We gotta pick a date.
Now, we won't pick a date right now. We're gonna wait. I want to see what the calendars look like. It's getting pretty crowded here.
I have 2 committees too, so.
Yeah, yeah, I got like 3 or 4 commissions and so what we'll do is we'll adjourn right now and we will send a scheduling type information out with several dates and pick the one that best fits your calendar and we'll try and fit everything in. Thank you very much for coming today. Have a Merry Christmas, everybody. Yeah.
Merry
Yeah.
Christmas, Happy Hanukkah, Happy Holidays.
not going anywhere tomorrow.
It'll be 9 degrees tomorrow.
Really?
What?
Raining today.
No, we're bringing the Salvation Army belt tomorrow. Is it me?
Oh, I'm supposed to.
There's balaclava, maybe some heavy rain here, like the 50. We're gonna sit in the car.
I think it's like the rain today.